Hello, welcome to the Alpha and Omega Health Podcast. We're here to inspire you to own your health and wellness. And this month, we're going to be talking about Flexion Distraction.
Let's get started with the Alpha and Omega Health Podcast with Doctors Rachel and Tri Myers.
Okay, so Flexion Distraction.
Yeah.
We both have this table at our office.
Yep.
What does it do? Why is that important to people?
So, I'm sure we have a lot of people that probably have back pain. So it can be helpful for just back pain, but it can also be helpful if you have radiating pain, so pain that goes into your butt cheek or the back of your leg, the front of the leg. It can be really helpful for that.
Okay.
So would you say any other things that you like?
No, that's a great one. So typically, when most people come to the office, they have what we consider like a mechanical lower back pain. So something's out of alignment or it's kind of pinched or something like that. And it's radiating pain because it's sitting there compressing that joint together. So that's where the flexion distraction kind of helps open up that joint. And then you also have a neurological pain where it's pinching a nerve. The good thing about this device or this equipment is it helps with both.
Yeah.
Can you go through why?
Well, I was just going to show you, and I don't know if we can zoom in on this. And this joint right here, when we increase the curve in the lower back, it can pinch on that nerve. So you can see how that's going to irritate that nerve and cause inflammation there. And so what that distraction table does is it actually kind of opens up that joint and the hole there. So it gets the pressure off of the nerve and it kind of does this.
Oh, here. Predator
Just
style.
like that. Oh, okay.
I didn't break it. Maybe the head turned around and backwards. So when the table flexes down, do you see how that opens up that area that Rachel was talking about? This is called a facet joint. So if you were to Google it, it's F-A-C-E-T. Now, this is the one I was talking about. It's a mechanical problem, so it will compress. And think of slowly slamming your finger in a door. Doesn't feel very good. Mm-hmm. And then all of a sudden, say, I deal a lot with weightlifters. So now all of a sudden, like you're already in this position and then now you put load on your back and it compresses it even more. I have patients sometimes.
If you're running, you think about running, it's just going to be
the actual compression. So we call this an axial load. It's going through, say like a rod for say like your tires, right? One straight line. What's happening is you're compressing this way. But when you look at it from the side, this is the big one where it kind of will bend that spine. So a lot of people have the issues here.
And a lot of ladies will have this increased curve in the lower. I'm really afraid you're going to hit me in the head with that.
Depends on what you say.
Okay. Oops. Some men can have increased curves in their lower back too. Mm-hmm.
So go back to the women.
So a lot of ladies can. You think about when women are pregnant, they get the bigger bellies, and naturally the pelvis will kind of go forward like that, increasing that curve there. Also, high heel shoes. High heel shoes actually causes the pelvis to do that as well. So that's why they aren't really good for you. They're going to increase the curve and cause more problems.
So we talked about Facet Syndrome, okay, is a mechanical lower back problem. You're talking about the pelvis rotating forward. Mm-hmm. If they were to Google that, what would you call that?
Hyperlordosis, is that what you're looking for?
So you got the hyperlordosis in the lower back and an anterior pelvic tilt. All you're doing is anteriorly tilting the pelvis.
You know, something that's really kind of cool. I had this one patient a while ago. She said, you know, a lot of my family has said that my butt looks smaller. And I was like, what? Have you been losing weight? And she was like, no, it's because you've been stretching me out. And what happened was... So you went from like the butt out here to
now all of a sudden your pelvis is back underneath you.
She had the right curve in her back, so her bottom didn't stick out like it had been.
At least her back didn't hurt.
Yeah.
All right, so that is for the mechanical part. All you're trying to do is, remember how we talked about that slamming your finger in a door and then like compressing it even more? Doesn't feel good. So we're trying to stretch that area out. Then we also have the neurological one. So this one's a little bit more of a serious problem, a lot harder to work on because in this little model here has like this little red little jelly bean thing right here. It's your disc bulge. So Rachel, can you talk about what a disc bulge is?
Normal spine here, but the way that your vertebra should move is individually, kind of like this, as you're bending and moving and all that kind of stuff. But when we get misalignments, it causes the whole spine or that area to kind of move together like this. And it's over time that all that increased pressure on the disc will start to cause the disc to get thinner. And then finally the disc can actually start to bulge or herniate out, which that's going to cause the hole where the nerve comes out to become that much smaller. The nice thing is, yes, the Flexion Distraction table works great for that. I'd like to kind of say it's kind of like sticking your fingers in a Chinese finger trap. If you try to pull it out, it almost like suctions it. As we're doing that traction, it's almost like it can help to kind of suction that disc back where it's supposed to be. Okay. But in our office, we also have decompression, which is another way that we can actually get that pumping motion that I was talking about a normal healthy spine does, so that the disc can start functioning like they're supposed to. I think people only come to chiropractors for pain, right? But they have the side effects of their organs starting to function better. So our nervous system, our brain and our spinal cord communicates with the entire body through our nerves. So if you're pinching on a nerve that goes to your heart, then you could have things that seem like you're having a heart attack or AFib, but really it's just a nerve was being pinched on. Bowel and bladder function. I've had a slew of patients that are always embarrassed to bring that up, but then later on they're like, oh my gosh, this totally helped with all that. So it's really cool that we're able to help that. And especially if we've got some disc issues, which you're about to talk about a disc, doing the traction is super helpful for that.
Yeah, it was interesting. Back in, I think, the 30s, they did some studies on cadavers, people who died. What did they die of? And it was interesting. They would go back to the spine and they found that a lot of the areas they died of had some excessive degeneration in that area. That, say, a liver problem. They tracked the nerve to where it was at the spine. They had some issue at the spinal level. Now, is that saying that the spine is what caused the liver failure or whatever? No, but can your liver repair itself when the nervous system isn't working the way it's supposed to? No, and it's plenty documentation to show that. So
it allows your body to function better.
Exactly. So we're not going around saying that chiropractic can cure every single disease in the world. All we're trying to do is trying to say, allow your nervous system to do what it's supposed to do. And guess what? A lot of times it does. Yeah. Okay. Now, another analogy I like to use for the disc itself, since it's, so you got the bone, of course. Your disc is, I always tell people, it's like a thick water balloon for the most part. Now, one analogy I like to tell people is when I'm looking at x-rays or MRIs, etc., think of a tire of a vehicle. Now, we look at it from the back, like you have the tire, the rim, and tire, and then the ground. Like for the most part, if it's pumped up all the way, it should be pretty uniform, straight up and down. You start to lose pressure in that tire, it starts to get closer together, it gets closer to the ground, and it starts to bulge out quite a bit. Now, I always tell people if you theoretically say it was only bulging to one side, all of a sudden, if you put all the weight of that car on that side of the tire, it would actually push it in, okay? Now, if I go the other direction, it would push more pressure out, make the bulge more. So that is why whenever we're doing certain movements, say on the exam, I have a herniated disc or a bulging disc posteriorly. It means it's hitting the spinal cord. When I bend over and touch my toes.
Back.
What's that?
Posterior.
Yeah. The disc is back. When I bend and touch my toes, it's going to make the disc bulge out more. Hurts a lot. Your body typically is like, stop not doing it. Typically, if you do an extension, it's like, hey, it might kind of feel a little funny, but it feels better. The neurological symptoms go away. So guess what? We would have you do those for like exercises to try to help reinforce that disc to go backwards.
So let's get back to our Flexion Distraction.
Sure.
Do you want to experience the amazingness of Ammon's chiropractic Flexion Distraction?
I guess it is maybe superior right now. My back is a little sore, so.
So let's get to it.
Nice.
Come on. So what we like to do is try to line up the pelvis a little bit above the crack in this table here, because what I want to be able to do is actually kind of open up and get a little bit of traction of the spine, and then I will do some other types of movements to kind of help with that as well. So what we're going to do is we're going to basically look at where the base of the spine is, and I want to kind of block the rest of the spine. So the way that I do that is I kind of grab the spinous process, which is what you feel when you run your fingers down your spine, with the base of my hand here. And I'm going to try to be stretching out this area right through here. So, and I don't need to go very far. A lot of people will want me to just keep on going, but I just want to see just a little bit of motion in the pelvis. So that way I know that I'm actually getting a good stretch in there. How does that feel, Trey?
Great.
So with what I'm doing here by bending the table like this, Trey and I were explaining how this helps to move and bring the tailbone more underneath you, as well as kind of opening up those jam joints, those facet joints that we were talking about. That's exactly what we're doing by moving the table like that. And then usually, because this is not just stretching your spine out, it's also going to be stretching out the muscles as well. So sometimes you can be a little bit sore. I like to just kind of feel the muscles as I'm doing this, because that'll help me to know, okay, are they starting to relax? Or are we having some spasms? That sort of thing. So I'm going to go up just a little bit higher on his spine to get a little bit more motion in there. And a lot of people will ask, well, how can I do this at home? There's not a really great way that you can do this at home, but what I really love to do is have patients get those big exercise balls and just kind of roll onto them and then kind of roll back. The importance is to actually get that pumping motion. So just like what I'm doing here by bending and then relaxing, you want to be able to create that same movement. And when you get on one of those exercise balls, you're able to do that a little bit better. It won't feel the same, but it at least kind of opens up those joints a little bit and gets motion in the disc, which is really what we need to do. Okay,
Boy, do I feel good now.
So Trey, what would be some things that the chiropractor should be telling our audience after they get a good distraction or decompression?
Sure. So if it's opening up the disc spaces and the discs are very fluid filled, we should definitely drink more water.
Heat or ice? That's the question. Which one?
What do you say?
I say ice.
We're actually on agreement on this part. So, I mean, ice is fantastic. I always tell people, heat's a catch-22. Everyone wants to do it because it feels good. Bad thing is at the time, but the bad thing is they do it for a little bit longer. Sometimes they fall asleep on the daggum thing, and then they wake up and they're like, "Holy smokes, what did I do?
I'm in so much
cannot
pain."
move," because now you just increased your inflammation in that area.
It brings a lot of blood there, and then you have the inflammation. So what we need to do is decrease inflammation. And how do we do that? You should know this. If you sprain your ankle, you put ice on it. Okay. So same thing with the back, right?
So research would also say like, hey, I'm supposed to like bring more blood flow to the area because it has more healing. So how do you think you can bring more blood flow to the area if you're not doing ice? Move. So that's what we're going to do. Give you some stretches, some exercises, etc. So to help reinforce that pattern.
So we're going back to, you like to go on like tangents.
Hey, I'm ready to get people moving.
I just got you moving. We just did some flexion distraction.
Sure.
After flexion distraction, you need to be icing and you need to be drinking water. We're just going to get to it here. Anyway. And we get you moving, right? We'll move to the exercises at another time. So all that to say, you guys need to be owning your health and wellness. So own it. Thank you for joining us.
Get it moving.
Like, subscribe, do whatever it tells you to do around here, and we'll see you next time.
See you next month.